So tonight we're going to be talking about things your pelvic floor wish you knew. So just some different stuff that we kind of help people with pelvic floor physical therapy. We'll talk through some kind of brief overviews of everything. If you guys have any more specific questions, as I said, you can drop your questions right in the chat box, and we'll get started. So, as you guys probably know, we are members of the Limitless Physical Therapy team. Amelia and I are both pelvic floor specialists. Our mission for Limitless is to grow a thriving community that inspires the best health outcomes. Our main specialties that we treat are pelvic health, orthopedic conditions, and balance and dizziness. We have 4 locations at this point. We have Victor, Brighton, Greece, and then our newest location out in Cortland, New York. We're just going to introduce ourselves a little bit here. So, as I said, I'm Jill. I work at the Victor Limitless location.
And I'm Amelia. I work at our Brighton Limitless location.
So we are both very passionate about our fields. One of the things that I'm most passionate about is empowering patients to take control of their own treatment in their own life in order to make them more successful long term. These are the topics that we're going to touch base on today. So kind of an introduction, talking about some urinary incontinence or leakage, things about painful intercourse, tension, and then a little overview of what pelvic PT might look like.
Just introducing the pelvic floor. What is it and who has one? So our pelvic floor is a collection of muscles that runs kind of between our sit bones in our pelvis. It wraps around to the front and attaches at our pubic bone, and then it wraps around and attaches at the back at our tailbone. And so all of these muscles are going to sit in the bottom of our pelvis, and they form like a little trampoline that are going to support all of the internal organs above that. So as you can see in this diagram down here, that is a side view of the pelvis. So our pelvic floor is going to support our bladder, which sits in the front. In women, the uterus is going to sit behind and kind of above the bladder, and then our rectum is going to sit behind that. And then all of our internal organs are going to be supported above that. So this is what the pelvic floor is, and everybody has one. So that means that anybody can experience pelvic floor symptoms. So getting into prevalence a little bit, about 1 in 4 women in the United States actually presents with some type of pelvic floor symptom. So this can include things such as incontinence, urinary urgency, pain with penetration, so either intercourse, OBGYN exams, tampon use, pelvic heaviness or pain, or constipation. And as we age, these difficulties can increase in prevalence. Okay, so talking a little bit about incontinence. There are many different types, but we're going to kind of just talk about stress incontinence and urge incontinence today because these are the most common types. So for stress incontinence, I want people to think about leakage that is going to occur with things like sneezes, coughs, laughter, or exercise. It could also just be general activity, so things like sit-to-stands or squats. And stress incontinence is going to occur as a result of weakness in the pelvic floor and core canister, so those muscles that kind of wrap around your belly and around your back to support you. Stress incontinence can also occur due to trouble with coordination with your muscles, such as contracting that pelvic floor layer to provide support with these activities. It might also be coordination in the sense of breathing correctly to manage pressure in your abdomen with these activities. So we can treat stress incontinence with things such as just like general strengthening, but we can also treat it and manage with the 3 E's that we have listed on the slide here. So the 3 E's are exhale and engage on the effort. So for example, if you were doing a sit to stand, standing up from the chair would be the most effortful part of the motion. So as you're standing up from the chair, you're going to exhale with that effort. So then on the flip side, urge incontinence is that type of leakage that is going to occur with uncontrollable urge. So people just aren't making it to the bathroom in time. This has a lot to do with our brain-bladder connection and nervous system activation, which we'll talk a little bit more about on the next slide. But some of the techniques that we can use to treat urge incontinence include diaphragmatic breathing or breathing with your belly. We can do heel raises because that kind of scrambles the signal getting sent from bladder to brain. We can walk calmly to the bathroom because that helps calm down nervous system activation. And then things like positive self-talk. So just telling yourself that you're in control, your bladder doesn't control you, you control your bladder, you're going to make it to the toilet in time. Things like that can go a long way. Okay, so here's our brain bladder connection. So for better or for worse, your bladder is going to remain trainable for your entire life. So, as babies, as toddlers, we're potty trained, but as adults, we can form habits that can impact continence in the future. So the picture of the bladder that I have over here on the right, we have this first line, which says T1. So our bladder is always filling. It's never completely empty. As our bladder fills, there are little stretch receptors in the bladder that are going to let the brain know when it's time to go to the bathroom. So as your bladder fills, it's going to reach this T1 or time 1 signal. It's going to tell your brain, hey, I'm getting kind of full. I might have to go to the bathroom soon. And a lot of people kind of ignore this urge, which is good because we have larger capacity in the bladder. So then your bladder continues to fill. It's going to come up to this T2 or time 2 signal. And your bladder tells your brain, hey, remember how I told you a little bit ago that I had to go to the bathroom? Well, now I really have to go. And so this is when most people choose to go empty their bladder, which is a good thing. We're letting bladder fill to its capacity. The trouble arises and we form poor habits when people start going to the bathroom at this T1 signal or even before that. And that's going to train your bladder to send you that urge signal sooner and sooner and sooner over time. So that's why some people, they'll be like, I just went to the bathroom 20 minutes ago. I know I emptied, but now I have to go again. So there are things that we can do in pelvic PT to help retrain that. Moving into hydration and bladder irritants. Hydration is really vital for a healthy pelvic floor, a healthy bladder, and just a healthy body overall. So we recommend that patients are drinking 64 ounces of water a day or half of their body weight. And I find that a lot of patients who have trouble kind of tracking this find success if you get a water bottle, you know how many ounces it holds, and then you're like, okay, I know I have to get 2 of these in a day or 3 of these in a day, and just spacing out their intake throughout the hours. In addition to general hydration, there are things that we can consume that might really upset our bladder and cause incontinence to either be a little bit more severe or just increasing urinary urgency. So some of these things can include caffeine, so coffee drinkers, tea drinkers, spicy foods, artificial sweeteners, carbonated beverages, yes, even seltzer water because that has carbonation in it, and alcohol. And I have over here on the right We call soda the triple threat because it has a combination of caffeine, carbonation, and artificial sweeteners. So typically, when I have people come in who are having a lot of incontinence issues and they're soda drinkers, if we cut back even 1 can of soda, 2 cans of soda a day, urinary symptoms tends to improve dramatically pretty quickly. Another note that I forgot to make about hydration in general, urine is acidic. So when we have poor water intake and we're not meeting that daily recommendation of 64, the urine that is sitting in our bladder is going to be less dilute just because there's going to be less water in it. So it's going to have a higher acidity, which is also going to irritate the bladder a little bit more and can make leakage symptoms more severe.
Okay, so moving into the topic of painful intercourse. There can be a lot of underlying causes for painful intercourse or painful pelvic area in general. Some of the biggest things that can contribute to this is tension in the pelvic floor, which we'll talk a little bit about on the next slide. A heightened nervous system, so being in a high stress or high anxiety environment or state, and a lot of the time. And the idea that pain actually reinforces pelvic tension. So if you're having pain with intercourse, those muscles in the pelvic floor may tighten up, which kind of creates this cycle of tension and then pain, leading to more tension and more pain. It can be a really common occurrence, especially in older women and postmenopausal women, but it can also happen with your first sexual encounters too. While it is very common, it doesn't have to be. Treatment is really specific to each individual based on that underlying cause. But some things that may help with treatment or that we may look into for treatment is relaxation techniques, breathing techniques to help with relaxation and really calm your nervous system down. Dilators can be really helpful in order to help stretch that internal vaginal opening and actually make things a lot more comfortable. Some of those other things can include internal or external or a combination of the two of releases of those pelvic floor muscles. And the last one that we might look into is different exercises to bring good blood flow to the pelvic floor or stretching to help relax those pelvic floor muscles.
Control over that.
So tension in the pelvic floor can be a really confusing subject, but it doesn't have to be. The biggest thing to realize with pelvic floor tension is that having mobility in the pelvic floor actually can contribute to better strength. Just because the pelvic floor is tight or tense does not mean that you have good strength and therefore good control over those muscles. The muscles of the pelvic floor can develop tension just like any other muscle of the body. You can think about this almost like a knot in your shoulder where your shoulders are hiked up all day or if you're stressed about something. It can arise for a number of different reasons, but the biggest thing to realize is that we need to have that full range of motion of the muscle in order for it to work efficiently. So our goal, if tension is your issue, is to reduce the tension. Tension can cause a lot of different things, such as pain, urinary urgency, or incontinence. It can also contribute to difficulty with defecation, so things like constipation or having pain with bowel movements. And it can also contribute to abdominal pain too. As we said before, we need mobility in order to be strong. So in this case, Kegels are not always the answer. We want to think of the pelvic floor like a trampoline. So those springs on the trampoline should be loose enough that they're able to give with pressure and go down, but they have to be tight enough that they're able to rebound. So now I want to talk a little bit about what pelvic floor physical therapy might look like. This can be a really intimidating thing, and it is really awesome if anyone wants to take that next step. I want everyone to have some good knowledge about what this might look like for you. The biggest thing to know is that this is unique to every patient. Also, your pelvic floor evaluation will begin in a private treatment room. So there's really nobody else knows what's going on. And you have time to actually talk with just your physical therapist about your issues or what's going on before anything else. Questions about your pelvic floor function will be discussed, and we can give you a more clear picture of the symptoms that are going on. The biggest thing to note too is that you as a patient have a right to refuse any treatment or evaluation techniques. Treatment will typically begin with a hands-on, clothes-on assessment, as well as education based on what your issues are, what those underlying causes might be, and where we're going to start with stuff. Based on that information, a personalized treatment plan is developed, which will likely include an internal exam at some point and exercises out in the gym. The point of the internal exam is to give us, as your therapist, a better picture of what is actually going on with your pelvic floor and what might be contributing to your symptoms. As I said before, you have the right to refuse any kind of treatment or evaluation technique. So if that's something that you're really uncomfortable with, you can just say no. We have other options. Typically, our treatment will be a combination of some kind of strength training out in the gym, mobility work, manual techniques, and most importantly, education. If you are out in the gym setting, we have a lot of different discrete language that we can use so that other people don't have to know your business. Everybody there doesn't need to know what you're coming to PT for. So we do a really good job of making sure that it's more of a private situation. As always, we really want to empower you to bring up any questions or concerns that you have with your PT. Next, we have talking a little bit about pregnancy and postpartum. So any of these symptoms can really apply to you during your pregnancy or in a postpartum period. We are actually going to be hosting another one of these next month, which are going to be focused in on pregnancy and postpartum stuff. However, just touching base on this here is they can happen during pregnancy or postpartum, even if you've never experienced them before. It is common, but it doesn't mean that things like urinary leakage or pelvic pain are permanent or have to be normal. Things that can contribute here is changing hormones, breastfeeding, and a lot of other things have a lot of effects on the pelvic floor and can lead to different symptoms arising during these periods. If you're experiencing any of these symptoms during pregnancy or just want to get more prepared for birth or get back to your pre-pregnancy activities if you're in a postpartum period, you can definitely book an eval with us or tune into our February workshop for a lot more information on that.